Today's video topic is occlusion training, everything you need to know. Occlusion training is also called blood flow restriction training. It is done to decrease the time taken to build strength and muscle size. The technique restricts the flow of blood to the muscle you are exercising to build its size and strength. How is occlusion training done? It is done using elastic wraps or pneumatic cuffs to reduce the movement of blood flow to your heart. This makes the body part you are working on become engorged with blood. For example, you can wrap your upper arms tightly before doing dumbbell curls to work out your biceps, which are the muscles on the front side of your upper arm. How does it work? This occlusion or blockage of the vein increases the lactate concentration of your blood. You can do your workout at a lower intensity, giving the feeling of a much harder workout. This makes your brain think that it is experiencing a difficult physical challenge. It then signals the pituitary gland to release more growth hormones, hormones that respond to muscle growth or hypertrophy. Is occlusion training safe? Although research results look promising, experts are still studying the overall safety of practicing blood flow restriction training. In 2014, a review that was done using blood tests concluded that occlusion training did not lead to a prolonged reduction in muscle function. It also didn't lead to an increase in indications of muscle damage. The review also revealed that muscle soreness is similar to regular workouts and that there was no extended muscle swelling. However, without proper guidelines on how and when to use blood flow restriction, you should not try it out. Are there any risks to consider? When using a tourniquet-like procedure such as an occlusion cuff for limiting blood flow, there is always a risk. The size of the band or cuff and the pressure that it exerts should be properly sized and aligned with placement on the body. The duration of use should also be monitored. For example, 2012 research of 116 people showed that there is a measurable difference when you use narrow or wide cuffs in blood flow restriction training. Wider cuffs restricted blood flow at a lower pressure. All types of exercises have their risks. However, occlusion training may be riskier, and this is because there are currently no safe protocols for the training. How is occlusion training used in physical therapy? Resistance training using moderate to high loads is often not possible in clinical settings. When you use occlusion training, loads can be lowered significantly, and you still get an acceptable level of muscular growth and strength. It helps to prevent the cardiovascular risk and high levels of joint stress associated with heavy load training. Blood flow restriction can also be considered an emerging clinical modality. All that is needed to be done is to establish safe use protocols. For example, it is unknown whether occlusion training is safe for those with high blood pressure or those who have conditions that affect the blood vessels.
Thank you for watching our video. Please do not forget to like and share the video. Also, please subscribe to the channel to stay updated on our latest videos.